Hello, my name is Kevin Olival. I'm the Vice President for Research at EcoHealth Alliance and a member of the global team for the One Health Workforce Next Generation Project. Really excited to present to you today. And we're going to talk about social innovation in One Health. And I'm going to walk through one case study that I've been involved with to hopefully give you a better understanding of what does social innovation look like in One Health systems, and how can we develop that, implement, and also test some of those solutions out. So just a quick outline, and this is a short version of a talk that I gave to the THOHUN-ELI group last year, but I wanted to keep it nice and brief for this recording. And if you're interested in building off of some of this information or knowledge, I'm available as a resource, and we're happy to send additional resources that are mentioned in the presentation. So we're going to begin with just a quick overview of what are the definitions for One Health and social innovation, and how do those two concepts link together, and where can we sort of leverage commonalities across both One Health and social innovation approaches. Secondly, I'm going to, for most of the talk, going to dive into a single case study of a One Health community outreach and education resource that we developed termed Living Safely with Bats for both Africa and countries in Asia. And that was part of the USAID PREDICT project that was developed several years ago. And I'll just finish with alluding to a few other One Health case studies that I had previously described, but we don't have time to go into those in detail. So what is One Health? A recent definition was put out by the One Health high-level expert panel of the tripartite group that includes, well, now quadripartite group that includes FAO, OIE, or the World Organization for Animal Health, the United Environmental Program, UNEP, and the WHO. And I think what's important about this definition, which is a very comprehensive one, is that, of course, One Health is about looking at human, animal, and environmental health together through a single lens. But you can see the left part of the figure there, that's only part of the definition. What One Health is also really a whole of society approach. And I think, the importance of mobilizing multiple sectors across the societies and communities, and really that multi-sector aspect of One Health, I think really aligns well with social innovation, as we'll see. So what is social innovation? Well, there's many definitions for social innovation, and I know that the THOHUN-ELI group has gone into some detail about those, and you've read additional learning material on this. But one definition that I liked from the University of Southern California was, it's an integrative and inclusive process that intends to generate more effective and just or fair solutions to solve complex societal problems. And that's really, there's a few concepts in there in terms of the definitions for social innovation. One of which is there's always a sort of public good aspect, right? You're trying to improve society, you're improving public good, and you're doing it in a way that involves innovation, right? Or bringing in new approaches. And these don't have to necessarily be globally new approaches, like something that's never been seen on the planet before, but they can be applied in a new way. And that's a really important thing, right? It could be a solution that might be common in another field, but you're bringing it into, say, a One Health or a disease perspective in a new way that really hasn't been utilized previously. And that sort of cross-sector approach or multi-sectoral approach is central to social innovation. It's also central to One Health approaches in terms of bringing in multiple disciplines, scientific disciplines, public health, veterinarians, environmental, ecologists, mathematicians, right? That all is a One Health approach, is really bringing those diverse disciplines together. So I'm going to just walk you through this example of the Living Safely with Bats book that we developed, which was an innovative One Health community education and outreach tool. And I'm going to frame this in terms of sort of the problem and then how the social innovation solution was developed. So the problem, if you want to view it as a problem, was that as part of viral discovery efforts under the USAID Predict project, a new Ebola virus, the sixth ever discovered Ebola virus species was found in bat populations living near people in West Africa. So these were bats that sort of lived roosting in people's houses, sort of close to human habitation. And so there was some concern that if this new virus indeed could infect people, that we would want to, as much as possible, right, stave off the probability that it jumped from bats into the human population. So that was a very proactive One Health sort of disease prevention goal, but also to stave off or to get rid of misinformation and fear, right? There was at the time really no strong evidence that this virus could infect people, but the really challenge was trying to be proactive with working with communities to inform them of potential public health risk, but also making sure that wildlife populations were not vilified and that the bats were viewed as also being essential to their community. The communities, part of the problem was the communities in which these viruses were found and the wildlife bat species occurred had really varying levels of scientific background and certainly One Health knowledge, and even literacy for that matter. And so it was really a challenge in developing a tool that could be used in communities with relatively low scientific literacy to get a clear message across. And working with community stakeholders from various countries, it was really acknowledged that we needed a strategy for people to live more safely alongside bats, both to reduce disease risk and to protect the populations of the animals. So this is a publication, some of the scientific evidence, the evidence base for the social innovation and the solution was that a new virus was discovered, was initially characterized, and obviously of concern because other Ebola viruses have caused large outbreaks. Indeed, this is coming after the large West Africa outbreak of Ebola Zaire virus. So we began as a group, the USA Predict project and all the stakeholders involved, to gather evidence and develop the evidence base for the solution, or the social innovation solution, if you want to call it that, which was the Living Safely with Bats tool. And I'll talk more about that. So we received expert input from 17 countries, and you can see the list there. That included Thailand, where the THOHUN-ELI project is active. There was a very great engagement with the Thailand Predict team in helping both develop the tool and also implement the tools I'll show you later. And really it built off the lived experiences from the communities, the stakeholders, as well as the Predict research itself that helped inform the evidence base for the solution. Social innovation is a very iterative process, and developing this tool was a long and iterative process, working with artists, working with scientists to make sure that all the technical details were correct, working with communities to make sure that those were interpreted properly, and that the images, especially the art and the images, really reflected the real world situation as much as possible. And then community focus groups were involved, where the book was initially reviewed and then again refined and improved based on that feedback. So the innovation is really this book, this product, which was not just the book that you would hand out and go to villages and hand out, but really listening to the community and knowing that, again, with low literacy rates in some communities, that really it needed to be a moderated picture book. So this was designed to be presented by a trusted community member. So again, working with the social system that was in place by working with village heads, religious leaders, community leaders, to really gather people together and explain the book and work in sort of a big flip book situation where in some cases the Living Safely with Bats was printed out on these big poster sheets, and people would actually kind of go panel by panel to walk through some key aspects of the messaging. And it really, I think it was a really innovative solution in that it really was at the intersection of art and science. You know, the team, we worked closely with a team who included scientists to develop the images, and then artists to sort of to initially hand draw those images, to import them into Photoshop and to Illustrator, and to manipulate them and really create the product. And that was pretty unique. And then the on the ground implementation also varied quite widely. And I think it was, you know, adjusting to the local context is a key message here for all social innovation work. And it was no different with Living Safely with Bats book. So for example, students were really key in Guinea, in the country of Guinea, in terms of working with students in schools to help sort of illustrate, they sort of re-illustrated the artwork from the book to sort of hit home some of the messages. And it was also shared with a rural radio station, and which reached millions of visitors, sort of giving the key messages out from the book. There's a school level, at a community level, which was engaged in all the countries, really. One example is just in Kenya, where the book was actually used. Some of the guidance on preventing bat-human contact were actually implemented in a small community center where some of the holes in the building were patched up so that bats were no longer roosting in the roof of the building to reduce human and bat contact. In Thailand, and I mentioned this before, we worked with targeted occupational groups. So guano collectors, bat guano collectors who collect guano for fertilizer, for agriculture. Working closely with communities in Ratchaburi, Thailand, to put out the sort of a unique Thai version of the book that was curated to get sort of the key messages across for that community. And our collaborator and colleague, Protect Thailand coordinator, went out there with the team and actually had a community meeting with the bat guano harvesters, and actually got some of the key messages about why you should worry about personal protective gear, what are some sort of low-cost solutions for protecting yourself, and how do you kind of deal with basic hygiene, sterility, and trying to, you know, keep things clean during that work. And then lastly, you know, some of the book was also used for more formal stakeholder meetings with government officials as a way to sort of bring back some of the findings from what was a multi-year surveillance project back to the communities as part of Project Closeout activities. So that's that was the Living Safely with Bats example of I think a really profound One Health social innovation example to mitigate, in this case, to mitigate disease spillover. Now, there are other case studies that I went through in the longer version of this talk that I don't have time to get to today, but I do encourage you all to look these up and to read some of the publications that have come out of this important work. And I think they're really, really great examples, again, by working with the local community needs to solve a public health problem. So the first example was using sari cloths, the fabric that that woman in the left photo is wearing, to cover the water as a sort of low-tech solution to filter out water to reduce the transmission of typhoid and cholera. Case study 3 is looking at bamboo skirts to prevent bats from coming in to feeding on date palm sap collection, which is a really great story of preventing Nipah virus transmission in Bangladesh. And this work has been going on for a while. Certainly some interesting work in terms of piloting these skirts, these bamboo skirts, but also some of the value in terms of the economic value that actually benefits the date palm sap collectors, because by using these skirts, they create a higher quality product. So there's sort of this microeconomic incentive to use these products, which is also another important part of social innovation, is thinking about the economics. And then the fourth case study from Thailand, I think many in the audience will be familiar, was the Olival model of reducing liver fluke transmission in communities in working with Konkan University, who developed some of these innovative One Health approaches. And I think that's a really excellent example as well. So that's all we have time for today. And I want to thank you, and looking forward to working with the THOHUN-ELI 2022 team, and happy to follow up with any feedback and questions you may have. So thank you very much.